Move to the next page. Let's welcome our first speaker. Karen Wonders is the founder and CEO of Maple Tree Cancer Alliance, and she's a professor of exercise physiology at Wright State University.
Earlier.
Maple Tree provides evidence-based exercise training to thousands of cancer survivors every month at 65 clinical locations across the US and in 16 countries.
Don't want to drive at night.
Karen Wonders has given
Right now,
numerous
watch the second half.
I'm sorry, could we try and mute microphones, please? Karen has given numerous professional presentations, including a talk at TEDx Dayton on exercising through cancer care. Karen, welcome and kick us off for day 2.
All right. Thank you so much. It's an honor to be here and talk with you all. You can move to the next slide. So I'm happy to talk with you all today about exercise oncology and how it can help someone as they recover from sarcoma. Next slide, please. Okay, so just to kind of set the stage, there were approximately 1.9 million cancer diagnoses in 2022 in the US. Of these, approximately 18,000 were new cases of sarcoma. So the Global Disease Burden Study in 2019 revealed that both sorry, I got sidetracked by the hi from Dayton. So the Global Burden of Disease study in 2019 revealed that incidence and prevalence of cancer were on the rise, while cancer mortality is decreasing. And this burden seems to be the greatest in individuals who are over the age of 70. Next slide. So when it comes to the impact of sarcoma on an individual's quality of life, we typically see changes associated with physical dysfunction. So mainly things that affect gait and posture, as well as decreased walking velocity and walking cadence. Oftentimes, this is due to the type of chemotherapy that's used to treat sarcoma, as well as amputations or limb-sparing surgeries that the patient may undergo. Next slide. However, there is a growing body of research that indicates that exercise can help patients with sarcoma, and therefore, we assert that it should serve as a vital component of comprehensive cancer care. So exercise can help to maintain physical fitness. It can help to improve strength and endurance. It can help a patient to manage symptoms. And then finally, it can contribute to an enhanced quality of life. Next slide. So when we use this term exercise oncology, I just kind of wanted to explain what that is, just so everyone is on the same page. Essentially, what we're using with exercise oncology is it is the use of physical activity and exercise to enhance the lives of people who are battling cancer. And so exercise, there's now more than 32,000 published peer review articles that look at the effects of exercise on cancer recovery. And these studies, time and time again, support that exercise is safe and it's effective in the life of someone who's battling cancer, no matter what the age of the patient, no matter what the stage of cancer, no matter what type of cancer. So when we're talking about exercise oncology, that's what we mean. And you can go on to the next slide. This study of exercise oncology actually dates all the way back to the 1950s. And I think this is really an interesting story. But in 1955, Dr. Rausch of the WinStar Institute in Philadelphia, Pennsylvania, conducted a study trying to show the opposite, trying to show that exercise was not safe and not beneficial in cancer patients. And so what he had mice who were forced to swim as they were going through chemotherapy treatment. And instead of showing that exercise was not safe and not effective and, trying to make a case for why people shouldn't exercise, he actually found the exact opposite. He found that the animals who exercised actually lived longer than the animals who remained sedentary. So that is the very first clinical trial that ever was for exercise oncology. We didn't see the first human trials until the 1980s. You can go to the next slide. And as you can see on this chart here, since then, since the 1980s, I believe it was 1986 was the first human trial. Since then, we have seen exponential growth in the field. So me personally, I have been conducting research and working in this field since 2003, so 21 years now. And you can kind of see where we were in 2003. We were pretty low on, the number of publications that were coming out. But I remember being a PhD student and conducting this research, and we would conduct research on rats. So we would have rats that were running on treadmills, and then we would give them chemotherapy, and we would measure the effectiveness of the medicine. We would look at, the toxicities and the side effects that the rats were experiencing, and then of course then translating that into humans. And almost immediately, I became a believer in this work because I could see the benefits that even rats were experiencing as they would go through treatment. And so I started my organization in 2011 to try to translate what we were doing in the research setting into the medical community. And you can see, since then, there has been exponential growth in this field of exercise oncology. That right there where it says 2023 and there was 2,600 published randomized controlled trials. Now I believe we're now more than 3,000 published randomized controlled trials that show the benefits of cancer and exercise. And that's just with the randomized controlled trials. There's also 32,000 other published peer-reviewed articles that show the benefit of exercise. Next slide, please. Back in 2019, there was a roundtable of experts from several different disciplines that came together to study the existing literature at the time. And out of this meeting, 3 papers were published. And this really, what I look at is this to me was a turning point in the field of exercise oncology, because it was after the publication of these 3 papers that really showed the documented benefits of exercise during cancer treatments. The one that I reference here looked at 8 listed symptoms that have the strongest evidence to show that they're positively impacted by exercise during cancer treatment. And these include things like fatigue, sleep, quality of life, anxiety, depression, body composition, function, and breast cancer-related lymphedema. Really, after the publication of these 3 papers is where we started to see a turning point with the medical community, leading to, go on to the next slide here, all of these professional, national, and international organizations writing endorsements for exercise oncology. So the one that I really want to point out here is number 1, ASCO. ASCO in May of 2022 published guidelines that essentially said anyone who's being treated with a curative intent should be referred to an exercise program. That was the strongest statement by a clinical oncology group here in America ever. So that was really huge. And then I think something else that's really interesting to point out, number 6, I understand this is a sarcoma group, but I do want to point this out. As of January 1st of this year, the National Accreditation Program for Breast Centers, the NAPBC, published standards where exercise was written in as standard of care in 4 different areas. Essentially, what they said was anyone treated with breast cancer needs to be assessed. Their functional assessment needs to be taken. It needs to be documented in the EMR, and they need to be referred to an evidence-based exercise program. The reason why I'm pointing this out is because this was the first tumor-specific group to put it into their accreditation guidelines, saying that exercise needs to be a part of the treatment plan. So just as surgery, just as radiation, chemotherapy is a part of the patient's treatment plan, the NAPBC said exercise needs to be at that level, that anyone being treated for breast cancer needs to be referred to an exercise program. We believe that this will open the door for all other tumors as well. As you probably are aware, most of the research and most of the funding dollars are, allocated traditionally to breast cancer, but we're starting to see other tumors and publications coming out to support the benefits of exercise in these other tumor sites as well. So we believe that soon, and we're working with number 5, the Commission on Cancer, to get this written into standard of care for all tumor types. Anyone who's being treated for cancer should be referred to an exercise program. So those are really exciting developments in the world of exercise oncology. Next slide, please. So ultimately, the overall goals of exercise oncology are to help the patient to participate normally in their life, whether it be work, family commitments, or simply just remaining independent as long as possible. And we believe, and research would support, that a targeted, individualized exercise program can have a profound impact on an individual's quality of life and positively influence many different areas all at the same time. Next slide. So this essentially is why Maple Tree was born. We want to come alongside of people as they're battling cancer and help to improve their quality of life. And the way that we do that is through individualized exercise training. And I'll explain what that means as we kind of go through the slides. But ultimately, our vision is that exercise would serve as part of the standard of care, not only here in America, but for anyone who is battling cancer anywhere in the world. And that's why we do so much international work as well as advocacy work here in the States. Next slide. So the way that our program works is everything is individualized to that person. And depending on where you are in your treatment regimen, your goals and your needs are going to vary just a little bit. And so what we do is we use a phase system to kind of categorize patients depending on where they would be in their treatment status. So a phase 0 patient is someone who is at the time of their diagnosis before treatment begins. Oftentimes you have a little window here where we can get some baseline measurement done. We can start the process of teaching people how to be active and how we plan to help them stay active while they go through their treatments. And you know, if you're listening to this and you've never exercised before, I would say take heart. That's very common. About 90% of the people we work with at Maple Tree have never exercised before. And probably the best time to start an exercise program is not when you're in the middle of treatment just because you don't feel good, but that's where most of our patients find us. And what they find is that they are able to handle their treatment so much better. And so they can see a stark difference from the middle of their treatment, you know, when they began to where they are now, if they start this exercise program. So, you know, if you're a phase 1 person, which means you're in the middle of chemotherapy or you're in the middle of radiation and you have the fatigue and the nausea and the anxiety and all of those side effects, the pain, the sleep disturbances, all of those things, exercise can help. And we do have people who come to us in the middle of chemotherapy, in the middle of radiation, to start exercising for the first time. And when we see patients that are in phase 1, so that's in chemotherapy and radiation, what we do is we can tailor our exercise intensity of how intense we have you exercising to help protect your immune function. And you're probably going to be relieved to hear this, but usually a low to moderate exercise intensity is where you see the maximal benefit to your immune system. And so those are things like walking, riding a bike, swimming, things where, you know, you're not resting, like you're in movement, but you're not doing high intensity exercise. Actually, high intensity exercise can stress your body and your immune system out, and you actually cause a little bit of a decrease to the immune system. So we keep people in that window so they have a maximized immune system. And then how that impacts their treatment is it helps to reduce things like dose delays and dose reductions in treatment and makes the person more likely to be able to complete their treatment on schedule. So that's a phase 1 patient. With someone who's phase 2, this is going to be someone who's completed chemotherapy and radiation, or maybe they didn't need it. Maybe they just had surgery and hormone treatment. It just depends on, you know, what their treatment regimen was. Our goal for phase 2 is to help improve self-efficacy so that someone feels confident exercising and they know what to do. They understand, you know, how to monitor their intensity, how long they should be exercising, how many days per week. We really spend a lot of time educating the patient in phase 2. And then finally, a phase 3 patient is someone who's completed active treatment. With this, what we do is we try to get patients exercising in the community. So we have partnerships with fitness centers where we go in and we train and certify their staff and teach them the unique needs of someone who is a cancer survivor. So that way, when the patient finishes their treatment and they enter long-term follow-up care, there's a safe place in the community for them to go and to continue exercising. Next slide. So over the next couple of slides, what I want to do is take a deeper dive into the specific goals of each phase so that you can see kind of how they would relate directly with you and the treatment journey. So the one thing that I do want to kind of just reiterate here is that it is safe for most people to exercise during cancer treatment. And if you are able to exercise during cancer treatment, that's really where you're going to see the most impact and the most benefit to your quality of life. So for someone who's in the prehab phase, as I said, this is the phase between the time of diagnosis until treatment begins. So our goal here is we want to minimize the anticipated treatment burden that comes when you begin cancer treatment. So ideally, we get baseline measurements. We really want to help that person to start off on the right foot, so to speak, kind of teaching them how to stay active and how we can support you as you go through your cancer treatment journey. The exercise recommendations for patients with sarcoma in this phase is we really need this treatment to be specifically tailored to your specific needs and abilities. So here are some general guidelines. You can move on to the next slide. So exercise during surgical recovery. So if you have surgery, move on to the next slide. You know, when it comes to sarcoma, there's many different types of cancer-related surgeries that a patient can undergo. So some surgeries have the goal of removing the tumor completely, while others just aim to debulk and improve symptom burden. And exercise has been found to have multiple benefits in the cancer population in terms of both pre and post-operative health. We have, documented research that shows a shorter recovery time, as well as improved tolerance to different systemic disorders that can result as a result of surgery. Next slide. So next I want to talk about the role of exercise during infusion therapy. Next slide. So exercise has been shown to improve several of the common effects of chemotherapy. So whenever we're talking about chemotherapy, that's what we mean by the infusion therapy. And research has shown that exercise can specifically improve symptoms of fatigue, anxiety, physical function, as well as helping patients to maintain their physical function and quality of life during treatment. And this holds true with patients who are being treated for sarcoma. Next slide. The one thing that I do want to mention here is that most of the literature is in individuals with more common cancer types. So this includes things like early stage breast cancer and prostate cancer. That is where the majority of research traditionally is. However, what I want to point out is that even with that being the case, it is reasonable to assume that these benefits of exercise can be experienced by any individual, no matter what your type of cancer is. We truly do believe that exercise is medicine, no matter what your health condition may be. And if you think back to how I got started in this field, I mean, even with rats, you could tangibly see a difference in the rats who were exercising compared to those who didn't. In terms of their side effect, their cardiac function, all of those things were improved. And so, I understand where you can feel discouraged that the literature might be lacking in this area for sarcoma patients, but we, have treated thousands of sarcoma patients through the 13 years that MapleTree has been in effect, and we do see tangible benefits to this population. Next slide. One of the more commonly discussed potential side effects of some chemotherapy drugs is cardiotoxicity. So that means that the heart doesn't function as well as it did maybe before the chemotherapy treatment. And oftentimes this is is kind of linked to a decrease in cardiovascular fitness. And that makes sense. If someone is experiencing, reductions in cardiac output, or their heart isn't pumping as effectively as it once did, that can lead to fatigue, and that can lead to a reduction in how much you want to go and do cardiovascular exercise. And so oftentimes what we see, like for a goal for someone who is in infusion therapy, oftentimes what we want to do is try to just maintain that cardiovascular fitness as that patient goes through the cardiotoxic treatments, to try to fight their cancer. And we do have evidence in data and measured outcomes in our patients that show that you can still actually sometimes even improve cardiovascular fitness even while receiving these cardiotoxic treatments, if you're able to stay active while you go through your cancer treatment. Next slide. We also utilize resistance training to help improve muscular strength and muscular endurance, which is also a negative side effect usually with infusion treatment. So usually with infusion treatment, you see a reduction in muscular strength and muscular endurance, both because leisure time activity decreases, but also because of the treatments themselves. And if you have amputations or just other side effects as a result of the infusion therapy that could interfere with protein synthesis and muscle building, sometimes you see that decrease. So that's another thing that we really try to focus on with the exercise training that we do. Next slide. Also, I do want to mention briefly just benefits related to radiation therapy. And, if you're undergoing radiation therapy for sarcoma, how exercise can help benefit you there. So next slide. Approximately 53% of patients with sarcoma will undergo radiation therapy. So this is an important topic to discuss. When it comes to radiation, the oxygen content in the tumors directly affects the sensitivity of the radiation. So tumors that have an abundance of blood flow tend to have the potential for increased oxygen delivery through exercise, which makes that tumor more susceptible to the radiation. So exercise, in essence, increases the blood flow to the tumor and makes that tumor more receptive to different treatments such as radiation and infusion therapy. Next slide. On the other hand, tumors with lower blood supply tend to have reductions in oxygen delivery, which makes them less effective to radiation. And so increasing the blood supply to the tumors through exercise helps to make these treatments more effective. So therefore, exercise helps to increase blood perfusion and oxygen delivery to the tissues, helping to enhance the anti-cancer effect of radiation therapy. Next slide. So the components of our exercise program, and I think this is really important, if you are listening to this and you want to begin an exercise program, we believe in individualization when it comes to exercise. And so that means any patient that comes to Mapletree, we pre-screen them, we get an idea of their medical history, their cancer history, how they're handling their treatments, what is their fatigue level, what is their pain level, how is it interfering with their quality of life. And then we also complete a fitness assessment. And with the fitness assessment, we want to look at all the different components of fitness. So we want to look at cardiovascular fitness, muscular strength, muscular endurance, flexibility, body composition, balance, posture, all of those things. And as a result of that fitness assessment, we are able to directly assess what are the strengths and what are the weaknesses of that patient. And then we can tailor the exercise prescription to directly impact those strengths and weaknesses that were identified. In terms of exercise programming, we want the patient to achieve the ACSM, American College of Sports Medicine guidelines for exercise, which is 150 minutes of exercise per week for cardiovascular. And we can break that up into 30 minutes a day, 5 days a week, if possible. If you're not able to do 30 minutes straight, then you can do bouts, 10-minute bouts in the morning, 10-minute bout in the afternoon, 10 minutes in the evening, or you can work up to it. If all you can do is 5 minutes, then we'll start at 5 minutes, but we'll gradually increase you so that you're able to achieve that 150 minutes by the end of the 12 weeks that we're working with you. And then we reassess patients every 12 weeks as they go through the exercise program, just to see, is this exercise program working? Are we seeing improvement? Do we need to tweak anything or change anything going into the next phase? And then also to share back with the patient the benefits and the improvements that they have made. Because honestly, it's so encouraging whenever you're working with someone who's in chemotherapy or in radiation or experiencing these negative side effects from treatment, and to show them that, hey, you started here, but now you've improved to here. That's so motivating and that's so encouraging, and really goes against what we traditionally think of when we think of battling cancer and the fatigue and the side effects. It just changes the narrative of cancer altogether. Next slide. So when we're talking about aerobic exercise, things like walking, cycling, or swimming, these are all things that are going to help improve cardiovascular fitness. They also help to reduce fatigue. And, sometimes when patients are experiencing fatigue, I think the natural instinct is let's just take a nap or let's just rest. And for a long time, that was what doctors recommended to patients. But research shows that even a little bit of exercise, and I experienced this with my grandfather when he was battling colon cancer, just a little bit of activity. And for him, it was just walking around his house. That helps to boost energy levels more than a nap, more than rest ever can. And so just 5 minutes of activity really can help enhance overall well-being. So as I said earlier, low to moderate intensity exercise is what we're looking for. And that means like you're walking, you're swimming, you can still talk, maybe not the way that I am right now, but you can still talk and carry on a conversation. And if you're able to do that, you're probably at a good exercise intensity. When it comes to resistance training, we're talking about weightlifting. So lifting weights or with stretchy bands maybe, or maybe even just body weight exercise. But that helps to improve or maintain muscular strength as you're going through treatment. And it's very important, especially in patients who are at risk for muscle weight wasting or who have seen some decreases to their physical function as a result of their treatment. So definitely you want to incorporate weight training into your program. Next slide. In terms of flexibility exercises, stretching and balance exercises like yoga or Tai Chi can really help to maintain flexibility, reduce muscle stiffness, and improve balance, particularly in patients if you have undergone surgery or have limited mobility due to the location of sarcoma or the treatments that you're on. You really want to try to incorporate stretching and balance exercises into your daily routine. Next slide. In terms of exercise intensity or duration, it's important to start slow and increase gradually. So start with low intensity exercises and then gradually increase as tolerated. So for aerobic exercise, if you can do 5 to 10 minutes per session to start, we would start you there, and then we would progressively increase the duration of that activity, keeping the intensity the same. So we're going to stay at the low to moderate intensity. But if you're starting at 5 minutes week 1, then we would try to push you up to 7 minutes or 8 minutes week 2, and then to 10 minutes week 3. And gradually we will increase your intensity until you're able to do 30 minutes continuously. If you can already do 30 minutes continuously, then what you want to look at is over the course of the week, are you hitting 150 minutes of exercise? So are you doing 30 minutes of exercise 5 days per week? And if you are, then you're achieving what's recommended by the American College of Sports Medicine. So stay there and aim to hit that as many weeks consecutively as you possibly can. Go on. Can you go on to the next slide there? Sorry. In terms of safety considerations as it results to a sarcoma population, you want to avoid high impact or any contraindicated contact activities. This will help to reduce your risk of fracture, especially if you've had bone sarcomas or if you're receiving radiation. And you want to also, while you're exercising, monitor for side effects. So look for things like pain, swelling, dizziness, shortness of breath. These all are going to be indications that you might need to stop the activity altogether reduce the intensity of the activity, or modify the activity that you're doing. So listen to your body. If you feel pain, if you see swelling, definitely stop what you're doing and reassess and look to see if you can make some adjustments there. Next slide. In terms of using exercise to manage treatment-related side effects, fatigue, as it comes to fatigue, 98% of patients experience whole body overwhelming fatigue. So the way to overcome fatigue through exercise is to use short, frequent bouts of light activity as opposed to longer duration sessions. So keeping in mind that rest is crucial, and listen to your body to avoid overexertion. So again, if you need to do a 5 to 10 minute bout and then pause, and then a couple, minutes later, come back and do another 5 to 10 minute bout of exercise, it's okay to break it up like that. You still see the benefits of the exercise, but it helps to also protect your fatigue as well. If you're experiencing neuropathy, things like balance and proprioception exercises are going to be particularly important. And making sure that you're taking care to reduce your risk of falls. So potentially doing seated exercises might be appropriate if you're experiencing some negative effects from neuropathy. And then finally, for lymphedema management, there are specific exercises and techniques that promote lymphatic drainage, such as just simple movement activities. So you should try to include those into your daily routines as well. Next slide. So if you are brand new to exercise, we really want to help you to get started with an exercise program. And so what we recommended is that you should set achievable and individualized exercise goals that are going to motivate you and help you stick to your exercise program. We also recommend that you have support with your program. So either from a caregiver or a loved one or a friend. Sometimes whenever someone's diagnosed with cancer, people just want to help, but they don't know what to do. So tell your friend, keep me accountable with my exercise program. Go on a walk with me, or, come to the fitness center with me. Just so you have that support system in place is going to be so important to adhering to the exercise program as you move through. We also recommend supervision. So supervision through someone who is certified in exercise oncology is what you would be looking for. So if you live in an area where we don't have a maple tree, number one, ask your doctor for a maple tree program. But number two, try to find someone who is certified in exercise oncology to work with you, because then they'll be able to tailor that program to your specific and unique needs. And then finally, we recommend that you take time to educate yourself and others on the benefits of exercise. Exercise during cancer is not something that a lot of people think about or know much about. And so being educated on how it can help you, listening to your body, and really understanding the importance of maintaining your activity during treatment will foster a sense of control over your health. Next slide. And so I just want to share this with you quickly, the impact of the exercise oncology program. This is now on more than 20,000 patients at Maple Tree who have gone through our program, who are in the middle of treatment. We have found a nearly 60% improvement in quality of life, a 15% improvement in cardiovascular endurance, an 18% improvement in muscular endurance, 20 or 32% improvement in flexibility. Patients feel more positive and more supported as they go through their exercise program. So truly, exercise is medicine. And finally, on the next slide, I do want to leave you with a free resource that you can scan and get more information yourself. And you can get on our email list. And we, oftentimes we'll do education pieces through our email list. So feel free to join that. And, we would love to work with you on that. So thank you so much. That's the end of my presentation.
Thank you so much. That was great. We did have some chats happening and happening on the side here. So a lot of people just commenting on how exercise has been helpful in their own situation. So definitely reinforcing some of the things that you talked about. There were a couple questions. I think we have time for one or two. There was a question about public swimming pools, because you did mention swimming as an
Mhm,
exercise that is beneficial for cancer patients.
mhm.
And so this person had asked, is there an infection risk? Are public swimming pools okay?
Oh, that is a really good question. So I have 7 children, and 2 of my oldest children are lifeguards, and I know that's something that they have to monitor, like with the chlorine levels and the different people that are coming in and using the program. So they work at YMCA's, and I know the YMCA's do have pretty strict protocols for that. So what I would recommend is just if you are going to swim like at a place like a YMCA or a fitness center that has a swimming pool, I would ask them kind of how they monitor the chlorine levels in the pool and how can they help to reduce your risk of infection with that, because I'm sure that they would have a protocol in place.